The U.S. Food and Drug Administration is expected to authorize booster shots this week for the Moderna and Johnson & Johnson vaccines. How big a game changer will that be? Hello, I'm Arnold Naidu, and this is The Heat. From Brazil to the United States, COVID-19 cases are on the decline. In Brazil, vaccinations are now outpacing the United States, Germany, and the United Kingdom. Nearly three-quarters of Brazilians have received at least one dose. Brazil is second only to the United States, with the number of COVID-19 fatalities now more than 600,000. In the United States, the seven-day average of daily cases dropped below 85,000, with hospitalizations also down significantly. Dr. Anthony Fauci, the U.S. top infectious diseases expert, says the country's recovery all depends on vaccinations.
The problem is, as we all know, we still have approximately 66 million people who are eligible to be vaccinated who are not vaccinated. The degree to which we continue to come down in that slope will depend on how well we do about getting more people vaccinated.
Well, for more now on the COVID-19 pandemic, let's bring in our panel. Joining us from Sao Paulo, Brazil, is Gustavo Ribeiro. He is the founder and editor-in-chief of the Brazilian Report. Joseph Williams is a senior news editor for U.S. News and World Report right here in Washington, D.C. From Los Angeles, Dr. Gary Richwald is an infectious disease expert and the medical director of Curative Medical Associates. And from Boston, Dr. Yaneer Bar-Yam is the president of the New England Complex Systems Institute. Thank you, everyone, for joining us. And Dr. Yaneer Bar-Yam, lots of talk these days about a booster shot. And as we reported, the FDA is expected to approve the booster shot for the Moderna and Johnson & Johnson vaccines. Could be as early as this week. The Pfizer booster shot already been approved, and it's already been given to people over the age of 65. But why are booster shots so important right now?
So the Delta variant has very significantly reduced the efficacy of the vaccine in the two-shot version, so that infection went down from being prevented about 1 in 20 to being only prevented by about 1 in 2, maybe a little bit more, which is clearly a very severe reduction. So people are going around thinking that the vaccine is protecting them, but it isn't protecting them very much from vaccination, from infection. There is somewhat more protection from more severe disease, but even that is quite a bit down. So if you get infected, you have an additional protection by a factor of, say, 2 to 3, maybe a little bit more, which is not a very strong reduction compared to what we had before. So the idea of the booster is to bring back up as much as possible the protection by the vaccine. And given the Delta variant is dominant in the world, that's an important thing to do. We don't know exactly how much it will help, but of course, it's important to increase the prevention so that cases are reduced dramatically.
So could the virus, Yaneer Bar-Yam, continue to mutate, and meaning that we will need more and more booster shots down the road?
Absolutely. The real necessity is to stop transmission as much as possible, because if the virus isn't transmitting, it cannot mutate. In the meantime, we still have a tremendous amount of cases globally, over 200,000 per day, and most of those are in really just a few countries. So the US and UK together account for over 30% right now of global cases, which is tremendously awful for what's going on in those countries. And in many other countries have much lower cases. In fact, Brazil, that you mentioned, is now down about 1/10 of where it was at peak, or sorry, 1/8. It's at about 45 cases per million, whereas the US is 10 times, not 10 times, or 5 times that much, at about 240 cases per million.
Dr. Gary Richwald, the United States has only fully vaccinated 57% of its population, and that's despite widespread access to the vaccination. There's still a lot of resistance to people getting vaccinated around the country. And if we look at some numbers around the country, we see that there's surges in infections in Alaska, Montana, Wyoming, North Dakota. Could we see a lot more infections in the months ahead in the United States?
Well, one of the problems is that this is, it's hard to say anything is urgent given everything that's happened so far. But it is urgent because if you think about this, every day that goes by is another day of falling immunity in a largely immunized population in the United States. And as that immunity falls, more breakthrough infections, more stress on the healthcare system, more people sharing that virus with others, causing additional infections. So we have nothing but bad news to look forward to in terms of this issue of the durability of people's vaccination. That is how long the protection and how well the protection is. So, I know there's a lot of other important political issues going on right now, but this one has got to come out from under the covers, and we really need to put a major booster effort in place. What President Biden said at the beginning, for which he got criticized for rather severely, because he was ahead of the curve, that the curve being the FDA and the ACIP, the CDC, really should have been listened to far more carefully. Because although we didn't have exact evidence in terms of being a virologist and understanding where vaccines, what happens in the natural history of vaccines, we should have responded much more quickly 2 months, a month or two ago.
Dr. Richwald, there's a point that both you and Dr. Bar-Yam have made, which I don't think many people know about, and that is the points that you make about the fact that the virus, it cannot mutate if it cannot spread. So I guess under those circumstances, people would still have to practice things like social distancing, wearing masks, etc., to prevent just that mutation happening.
Well, that's absolutely correct. And we have a largely potentially vaccinatable group in the 12 to 17-year-old group, But those people's parents, the most recent data shows, 58% of them do not want schools to mandate vaccine, which is the equivalent of saying, for the most part, that they're not going to vaccinate their kids, and that's just what we're seeing. So we have another under the cover issue, which is parents, and pediatricians have been historically not had much impact on adolescents for a whole bunch of complex reasons, and this is a population that is very social, very mobile, and we need to put up the red flag and get the parents to come over to, I'm going to vaccinate Jill or Johnny. And we're not, you just don't read about that. It's not, I don't see it happening.
Joseph Williams, vaccine mandates, that's causing a lot of controversy around the country. We hear it every day. We see it on our television screens, we hear it on the radio, we read about it on newspapers. I mean, we look at Chicago as an example. More than a third of the Chicago police force have ignored a deadline that was only a few days ago, October 15th, to get the shot. They could lose their jobs, they could even lose their pensions, their retirement benefits right now. What's going on with first responders?
You've got a population that is very much on the conservative side of the spectrum. Many law enforcement officers do relate to the fact that a mask mandate may be infringing on their personal freedom, but you also have the last year and a half of what's been going on. Certainly the protest against police brutality has sort of felt like officers have been backed into a corner that they feel underappreciated, and that some of them say that this mandate is just another thing that the public is imposing on them to show them how unappreciated they feel. But there are other first responders who are similarly resistant to trying to get the vaccine mandate in place. Those include paramedics, they include some physicians who arguably should know that a vaccine mandate will help make their jobs easier. But again, these tend to be populations that are more on the conservative side of the ideological spectrum. Police unions are very, very strong and support a lot of candidates on the right, a lot more to the degree that Democratic candidates do. And it just seems like we're stuck in this morass where the population is polarized. Even people who should believe in mandates, whose mandates, like where mandates will make their job easier, it falls to them to try to make the pandemic go away a little bit faster, and they're just resistant to do it no matter what.
So, Joseph, we have a situation now where police feel they're underappreciated and will not be receptive to any kind of instruction to get the vaccine. And that's, of course, being compounded by, as you point out, the fact that many police unions, etc., belong on the right side of the spectrum. So this has become also politicized to a large extent, hasn't it?
It's been politicized almost since day one, this pandemic has, when President Donald Trump decided that it was not a thing that he needed to pay attention to right away. We got behind the 8 ball there. He ended up politicizing most of the response, most of the early response certainly, vaccine mandates, vaccination rates, mask mandates, the whole spectrum of things that we could do urgently to prevent this virus has fallen on deaf ears on to a large extent to people on the right. You overlay a map of people where the vaccination rates are high, and they are not states in the South. They are not states that voted for Donald Trump. It's frustrating and maddening to a lot of us who are tired of wearing masks. Everybody presumably is, but you have this one pocket of resistance that's really been difficult to bring around.
Okay, let's go to Sao Paulo in Brazil. Gustavo Ribeiro, lots happening in Brazil right now as far as COVID-19 is concerned. The country has lost 600,000 people to the virus, which is second only to the United States in the number of fatalities worldwide. But right now, vaccination rates are up significantly. What can you tell us about the situation in Brazil?
Yes, we are in the best moment of the pandemic since April 2020, when cases started to rise fast, and it was the first wave of infections in Brazil. Right now, we have about 3/4 of the population with at least one dose, and almost half of the population with fully immunized. And that has been the turning point for Brazil, because here we have an extremely informal economy. Most workers cannot afford to stay home and respect social distancing. They have to go out and work because they are pretty much on their own. And the government aid policies have been reduced since September last year. So they were pretty much left on their own device. And it was vaccines what really made Brazil get to this stage right now. But experts here are unanimous to say that it's still too early for a victory lap. We're still, the rates of teenagers vaccinated, for instance, are very low. So we still have to be extremely vigilant here.
So, Gustavo, just a few months ago, the numbers were very low. That's changed right now. What changed, really?
Well, shipments arrived. The fact that Brazil could have started its rollout much sooner than it did. President Jair Bolsonaro deliberately stalled deals with Pfizer and with other manufacturers. He boycotted the initiatives by the São Paulo government to get the Sinovac vaccine to Brazil. He didn't want it. And it was by political pressure, because the pandemic has shown that Brazil is not an anti-vax population. All polls show that over 90, sometimes 95% of the population says that they either have gotten a vaccine or they want to do it as fast as they are eligible. This pandemic has shown this eagerness. And as soon as vaccines started to get available, the political pressure by voters was overwhelming for the government to ignore. So the government was forced to shift from this chloroquine-based pandemic response to actually getting vaccines into states and municipalities. And the fact that Bolsonaro was personally against vaccines made a lot of governments, local governments, to try and get vaccines on their own. So that also helped to secure deals for Brazil. And since April and May, rollouts picked up, because Brazil has traditionally an extremely well-equipped vaccine infrastructure. This is a country capable of rolling millions of doses every day. And the early problems was more supply rather than infrastructure.
Dr. Yanir Bayam, at present, only people over the age of 65 can get the booster shot. But given what you told us earlier on about the Delta variant and the fact that the virus could continue mutating, I mean, do you see us getting to the point where everybody's going to have that booster shot?
There's every reason to subject to safety testing, which is still beginning, right? But surely there's every reason to give the population boosters in order to really squelch the transmission. And there is already strong evidence from Israel that started the use of boosters. And indeed, deciding that 2 shots is the right amount is not etched in stone. And so now it seems that we need at least 3 in order to get to immunity. Again, this is against the Delta variant, and we don't know what's going to happen with the next one. And there may need to be a different vaccine altogether. But in the meantime, if the booster is helping to stop the transmission, it's super important. And I want to say that, globally, what we see still is, going back to your comments, that we really need not just the vaccines, but other things. Because we see, again, in the US and the UK, there's still a huge amount of cases, but there are countries that are dramatically lower in number of cases. Japan is dramatically lower. Right next to Brazil, Argentina is much further down in cases. And the way this has to be done is by a combination of vaccines and other things that people are doing, including masks, including distancing, including remote learning, and including travel restrictions and caution about transmitting it from community to community.
All right, and Dr. Bayam, there is one other complication with booster shots, and this is an international issue. And the WHO, in fact, has complained that countries like the United States, other developed countries, really have to hold off on third shots right now, booster shots right now, until the rest of the world, especially the developing world, get enough vaccines. Many of the countries the vaccination rate is incredibly low. It's in single digits in some countries. I mean, does the WHO have a point there, and how does that complicate the situation?
There's no doubt that the challenge of achieving reduction in the cases and the impacts of those cases on people in terms of health and in terms of their severe disease and in terms of deaths would tremendously benefit from having much wider vaccine availability. And this could be done. I mean, there is a lot of challenges that have to do with both the financial aspects of vaccines, the patent rights, and so on. And it really would be much better if we all realize that this is a societal challenge. It's a global challenge that we should all be making sure that we do it as fast as we confront with the greatest effort of our time in order to stop transmission globally. And just to again make this point, China has shown that elimination is possible. Now we also have India, which is far down in cases. And I mentioned that the US is at 200 cases per million. We have India is at 10 cases per million, and there are over 500 million people in India live in states with under 20 cases per day. They had a huge outbreak. So countries now that had very large outbreaks in the past really still have a chance to get the cases way down and to make a decision that we should get rid of this virus locally, and then hopefully we can expand that progressively around the world.
Dr. Gary Richwald, you are in California, in Los Angeles right now. That is a state which has a mandate across the state for the vaccine. How have people been responding to that mandate, especially parents in the state, some parents I should say, who've been critical of the vaccination being given to their children?
Well, people confuse individual rights and freedoms with the fact that we live in a community, whether it be the worldwide community that was just described or the local community. And I was just up in the high desert here in Los Angeles County, and strong Trump area, and we have enormous problems with parents who are themselves not vaccinated, attacking school board members, and verbally, I'm talking about, and this is not helping matters in any way, shape, or form. If I can just go back to what was just said,
Yeah.
if we don't, I just want to talk about vaccine availability in the rest of the world. The formula for doing this is to have the companies share their technology and establish plants for production in Africa, in all the locations of the world that are not going to get their fair share of vaccine. This does not require the Rand Corporation to do a 7 decimal point analysis. This is what's needed. We need to require that the companies share their technology, pay them whatever we need to, and open those factories. And the sooner we get started with that probably is going to take 6 months to a year, the better off we're going to be. And so I think that's an incredibly important issue, which really, again, hasn't been discussed. And so, I mean, that's of concern that we're not going to vaccine around the world.
But Dr. Richwald, why do you think that hasn't happened up to now? It's a case of, I mean, we've heard this term before, vaccine nationalism, countries guarding their patent rights to the formulas, etc. Why hasn't it happened?
Well, I think we all know the answer to that. I think it's a good question. I think the answer is this has to do with control and has to do with economic dominance. And I understand. We live in a capitalist society. I understand the importance of that, and we've made some good strides here in producing vaccines without question. But this lack of understanding of what it's going to take to allow us to travel and to have some sense of comfort with our parents, with the elderly, with individuals like Colin Powell, who should have died, and someone wasn't vaccinated or wasn't doing, as you say, some of the other things, and allowed to get infected. We have in the United States, we just have to have a more charitable view of this. If you forget public health, if people don't understand the public health issues, we need to at least look at the charitable, religious, and moral and ethical, angles, which have not been well discussed.
Joseph Williams, there's been one other development in the United States, and that is the Biden administration has announced that U.S. travel restrictions will now be fully lifted on November 8th. And that is for fully vaccinated travelers. All the vaccines that have been approved by the WHO will qualify for this. What kind of impact is that going to have?
It's going to open us up to more economic development. I think it's part economics as opposed to part vaccine control, because we still don't have a grip on the vaccine here in this country. I think the net impact is going to be that people are going to feel a little bit more free to get around the country and get around the world, and we'll have people coming over here and vice versa. But again, that it risks opening up another Pandora's box, because we don't have the level of vaccination rates that we should have, not only in this country, but around the world and other Western countries where people are more likely or have the money to travel to the U.S. So I think until we get more of a grip on this, Biden's trying to walk a little bit of a tightrope here between economic development and looking like we've returned to normal, but actually knowing that the pandemic is still raging, and that the more travel and the more exchange of people from one country to another, and unvaccinated people from the United States moving around, the riskier things are going to be that we'll have another variant pop up, and that we'll be right back where we are right now.
Gustavo, I want to get to another controversial issue, and that is vaccine passports. In fact, recently, the Brazilian president, Jair Bolsonaro, he was turned away from a soccer match because he's not vaccinated. This is what he had to say when that happened. Let's listen.
Why a vaccine card, a passport? I wanted to see the Santos game, and they told me that I have to be vaccinated. Why is that? I have more antibodies than those who got the vaccine.
So, Gustavo, Rio de Janeiro and Sao Paulo are cities, big cities in Brazil that require a passport. What's the response been like, and is that working?
Well, it's hard to say if it's working or not because several commercial lobbies have gotten their businesses out of these vaccine mandates. For instance, bars and restaurants, which are places that are highly have a lot of people every day. The Association of Bars and Restaurants of Brazil lobbied hard with local governors and mayors, saying that they lost a lot of money during the pandemic and they did not want to lose more money by turning down customers that are perhaps not vaccinated. But like I said, in here, the question is not whether people want a vaccine, but if they're able to get it. Now we are seeing in places like São Paulo and Rio, vaccination rates extremely high in São Paulo. They are above 100% of the number of people vaccinated in São Paulo with at least one dose is higher than the actual population, the adult population. So it means that most, if not all, adults living here have been vaccinated, and people from neighboring towns are coming to get their vaccines. That's pretty much the thing about vaccine mandates here is more in sports venues and this kind of mega event. But in day-to-day life, people want a vaccine here. It's not necessarily an issue like it is in the US, for instance.
Dr. Yane Bayam, I want to get to something that Dr. Richwald talked about a moment ago, and that was the death of the former United States Secretary of State Colin Powell. It's been causing quite a buzz here in the United States. We were told that Colin Powell died from COVID complications. He was someone who was fully vaccinated, but it's led to the anti-vax lobby proclaiming that his death proves that vaccines don't work. What do you make of that?
So the problem is that people have elevated the vaccines and not been realistic about the protection. So again, vaccination is not a solution. It is a tool towards the solution. And that misunderstanding has confused the conversation and has confused the expectations. So on the one hand, people are trying to be encouraging about getting vaccines, which is a good thing.
Right.
But on the other hand, by making it sound like the vaccines will prevent every consequence of the disease, you have two problems. The first is that people do get infected and can die. There is a reduction. But the other thing is that people don't take the other precautions that we need to take in order to reduce the cases along with doing the vaccination.
Okay, and that's where we have to leave it. We've run out of time. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Arnold Naidu in Washington, D.C. Thanks for watching.